Numb feet after 60 are not just an annoyance or a normal part of aging. They are often an early warning sign that the nerves in your legs and feet are slowly being damaged. The main problem is loss of nerve sensation, and the promised solution is identifying and correcting one critical vitamin deficiency that many seniors unknowingly develop as they age. When numbness sets in, the danger is real. After 60, reduced feeling in the feet dramatically increases the risk of falls, balance problems, unnoticed injuries, infections, and loss of independence. What begins as mild tingling can quietly progress into weakness, poor coordination, and fear of walking without support. I am Dr. Edward Collins, and for over 25 years, I've helped adults over 60 understand circulation, nerve health, and nutritional gaps that quietly undermine mobility and independence. Here's the alarming part. Studies show that up to 1 in 3 adults over 60 has some level of nerve dysfunction in the feet, and vitamin-related nerve damage is far more common than most people realize. More than 20% of seniors are low or deficient in a key nerve-protecting vitamin, often without obvious symptoms at first. Many continue walking, driving, and exercising while nerve signals are slowly fading. What's at stake is not just comfort, but confidence, balance, and freedom of movement. In this video, I'll walk you through a ranked list of solutions, from least helpful to most effective, and reveal the single mistake most seniors make that allows numbness to quietly worsen year after year. To understand why numb feet become so common after 60, we need to focus on one core biological issue: gradual nerve fiber damage caused by impaired nerve insulation and slowed signal transmission. Your peripheral nerves rely on a protective coating called myelin, along with steady energy supply to transmit sensation from the feet to the brain. As this system weakens, signals become delayed, distorted, or completely lost, leading to numbness, tingling, or burning sensations. Researchers and geriatric specialists consistently point to vitamin B12 as a central player in this process. B12 is essential for maintaining myelin and supporting nerve repair. Clinical studies show that low B12 levels are strongly associated with peripheral neuropathy, especially in older adults. One large population study found that adults over 60 with low normal B12 levels were significantly more likely to experience numbness and balance problems than those with optimal levels. Another finding shows that up to 30–40% of adults over 65 have reduced ability to absorb B12 from food due to lower stomach acid and changes in digestion. This is why the problem accelerates after 60, even in people who eat normally and follow standard dietary advice. Aging stomachs often produce less intrinsic factor, a protein required to absorb B12. Certain common medications, including acid blockers and metformin, further reduce absorption. As a result, nerves slowly starve of what they need, even when blood tests appear only mildly abnormal. The damage accumulates quietly until symptoms finally become impossible to ignore. One major mistake many seniors make is assuming numb feet are simply poor circulation and trying to walk it off or massage the area. While movement is healthy, this approach does nothing to repair damaged nerve fibers or restore nerve insulation. The damage continues silently beneath the surface. Another common habit is relying only on a standard multivitamin. Most multivitamins contain low, poorly absorbed forms of B12, which are often insufficient for aging digestive systems. This leaves nerve tissue undernourished, even though people believe they are covered. A third misconception is waiting until numbness becomes painful before taking action. By the time burning or sharp sensations appear, nerve signaling has already declined significantly. Standard medical advice often focuses on symptom control, using creams, pain relievers, or balance aids, rather than addressing the biological deficiency driving the problem. These approaches may reduce discomfort but do not rebuild nerve health. The medical gap is this: symptoms are treated, but nerve nutrition is overlooked. Researchers now recognize that early nerve decline related to vitamin deficiency is often slow, progressive, and partially reversible when addressed correctly. When the underlying biology is supported early, nerve signaling can stabilize, and in many cases, sensation can improve rather than continue to fade. At the bottom of the list is simply ignoring numbness and hoping it will go away. This offers no biological benefit and allows nerve damage to progress unchecked. Studies show symptoms typically worsen over time, with no improvement in sensation. The clear verdict is that inaction leads to continued decline. Slightly higher on the list is foot massage and warm soaks. These can temporarily improve comfort and blood flow, sometimes reducing discomfort by about 5 to 10%, but they do not repair nerves or restore sensation. Their limitation is that the effect is short-lived and purely superficial. Next is regular walking or balance exercises. Movement supports circulation and muscle strength and may reduce fall risk by roughly 10 to 15%, but it cannot rebuild damaged nerve insulation. Exercise helps the body cope with nerve loss, not reverse it. Another common approach is using topical creams or over-the-counter nerve pain products. These may dull surface sensations by 10 to 20%, yet they do nothing for nerve signaling and often stop working with repeated use. Higher on the list is improving blood sugar control and reducing inflammation through general diet changes. This can slow further nerve irritation and may prevent additional loss, especially in those with prediabetes, but it rarely restores lost sensation on its own. Moving further up is increasing dietary B12 through food like meat, eggs, and dairy. While biologically helpful, absorption after 60 is often limited, leading to only modest improvements for many seniors. Near the top are oral B12 supplements using better absorbed forms, which can improve nerve markers in a significant portion of older adults. However, absorption still varies. The number one ranked approach, supported by clinical practice and research, is targeted absorbable B12 support, designed for aging digestion, which directly addresses the nerve's nutritional needs and offers the greatest potential for stabilizing and improving sensation when used correctly. The top 3 solutions for supporting nerve health after 60 begin with consistency, absorption, and timing. Third on the list is increasing B12-rich foods like fish, eggs, lean meats, and dairy. These provide natural cofactors, but for many seniors, absorption remains limited, making this a supportive step rather than a primary solution. Second is standard oral B12 supplements, which can raise blood levels and improve nerve support in some adults, especially when taken daily. However, results vary widely because aging digestion often blocks full uptake. The most effective approach is using a highly absorbable form of vitamin B12, such as methylcobalamin or sublingual B12, which bypasses much of the digestive limitation. Clinical evidence shows this form better supports myelin repair and nerve signal transmission. A typical evidence-aligned dose for older adults ranges from 500 to 1,000 micrograms per day. It is best taken in the morning, placed under the tongue if sublingual, and allowed to dissolve fully without swallowing for at least 30 seconds. Most people tolerate B12 very well. A harmless side effect in some is mild restlessness if taken late in the day. A realistic medical caution is for individuals with kidney disease or those undergoing cancer treatment who should discuss supplementation with their healthcare provider. When used appropriately, this approach directly supports nerve biology rather than masking symptoms. The most critical mistakes to avoid are ignoring early numbness, relying only on topical fixes, assuming a multivitamin is enough, and stopping support too soon. Nerve decline after 60 is not simply old age. In many cases, it reflects a slow nutritional and biological deficiency that can be supported when addressed early and consistently. For the next 30 days, focus on one simple goal: protect your independence. Support nerve nutrition daily, walk mindfully, check your feet regularly, and notice small changes in balance and sensation. This is not about reversing time, but about giving your body what it needs to stay steady, safe, and confident as you move through daily life.